President Trump tells the Wall Street Journal he might consider withholding billions of dollars of Obamacare payments to health insurers to force Democrats back to the negotiating table on the issue of health care. That comes as the president's budget director says he's cautiously optimistic a package can be worked out between the White House and congressional Republicans. One of the sticking points, subsidies paid for you by you. Correspondent Peter Doocy takes a look tonight.
Obamacare is still the law of the land, so insurance companies are still getting subsidies from the federal government to help the poor get covered. Some House Republicans sued to stop these subsidies years ago, but the case hasn't been resolved, so the payments go on. What happens next? A Health and Human Services spokesperson says, quote, "The administration is currently deciding its position on this matter. We have not been contacted by Democrats to help save Obamacare, perhaps because they consider Obamacare to be a losing cause." One of Obamacare's architects insists losing these subsidies could sink the insurance marketplace.
It would be seriously destabilizing in two ways. First of all, just saying we're not going to pay them would make a lot of insurance companies leave. And the second element of destabilization is that the insurance premiums would skyrocket between 10 and 20%, it's estimated.
And if the market is destabilized, experts warn of a domino effect.
If the subsidies go away, consumers will have a much more difficult time getting to their doctor. If they have to go to the doctors will have a much harder time getting paid. So not only does it hurt the consumers who need to go to the doctor and need that care, it can also be harmful to the doctors in the hospitals and their communities.
But that doesn't mean President Trump isn't still constantly confronting unpleasant surprises.
Even now, as I came in here, they're saying payments have to be made that weren't scheduled to be made on Obamacare. If you don't make them, it fails. I mean, you know, it's just a mess. Obamacare is a total mess.
Looking ahead, round 2 of Republican deliberations about repealing and replacing is apparently going much better than round 1, when the GOP's moderate and conservative wings didn't agree on much.
I talk to members of the Freedom Caucus. I talk to members who are not in the Freedom Caucus just about every day, as do other folks in the White House. And those discussions are continuing. It's a lot more organic this time, and there's some good ideas that are sort of filtering up.
Earlier this week, the leader of the Conservative Freedom Caucus, Mark Meadows, hinted that Congress could come back from recess early to vote on an Obamacare replacement. This afternoon, a Freedom Caucus spokesperson poured cold water on that idea, but just in the last 5 minutes, I got this from a spokesperson with Speaker Ryan's office. She says, if it becomes clear we have a path to 216 votes on an agreement, the Speaker will bring members back. Brett.
We will be watching that. Peter, thank you.